Good evening. Good evening, ladies and gentlemen. My name is John Brockington, and I again have the honor and the pleasure of being your Master of Ceremonies for this 2014 National Minority Quality Forum Leadership Awards Dinner. Now, a little light housekeeping before we start. In the past, we've had some issues with people talking while the presenters are talking. Now, we're all dressed up, and I want everybody to put their best foot forward tonight, so when the presenters are on stage, please control your conversations. But if you just have to talk, feel free to step outside the room and carry on that conversation, okay? But while the presenters are on the stage, please just keep it to a dull roar, okay? Okay, at this time, I'd like to invite Dr. Gary Puckrein and Congressman Christensen to make opening remarks.
Go ahead. Okay. Good evening. I want to first thank everyone for coming out tonight. This is both a celebratory evening and one of really great sadness. I've been working with Congresswoman Christensen and her staff on this summit and awards dinner for 8 years. And like every good thing, they come to an end. And so we're going to talk a little bit about endings this evening and a lot about new beginnings. I have really enjoyed working with Congresswoman Christensen. I remember, and I still remember, her sitting, because during the summit we sit through what is a grand town hall meeting. And not only did she sit through the whole event, which of course anybody who knows Gary Puckrein knows it's not possible for him to sit through a whole event. I mean, I just don't have it. I can't do it. I'm ADA or whatever it is. But she also captured and summarized exactly what everyone said. So she wasn't just sitting there. She was capturing and summarizing and then leading in terms of helping our community forward. And I marveled at that and realized to be an elected official, you had to have a unique set of characteristics and character to do that. So it's been a tremendous honor. And so with that said, Congresswoman Donna Christensen.
Thank you, Gary. It's a bit. Thank you, everyone. It's wonderful to see everyone here this evening, and it's a bittersweet time for me too. This being my last spring Braintrust in the capacity as chair of the Health Braintrust, but not hopefully my last spring Health Braintrust. So I look forward to continuing to work, and it's been a wonderful 2 days that we've had. It's been very informative. It's been very challenging, very energizing, very inspiring for all who have been here to listen to the great speakers that we've had, the panels, and the discussion with the audience. But it's been an even more spectacular 8 years, Gary. And I want to thank you for your partnership, your friendship, for all of the great things that you have allowed me to do with you and the National Minority Quality Forum over these eight or more years. So it's been great. I want to just say a word of thank you to the National Minority Quality Forum and Gary and all of his staff. I want to say a big thank you to everyone who has been a partner with us from the private sector and from the not-for-profit, all of the community organizations. The Health Braintrust has always reached out to our partners, and we could not be successful in anything that we ever tried to do without those partners. I have some wonderful staff in the room. I'm sure they're all wandering around, but of course, my staff, I want to thank them, especially Dr. Britt Weinstock, who is really the brains behind all that has happened in the Health Braintrust since she's been here. Please give her a round of applause. Britt, where are you? There she is. Doing all of this while earning her PhD, which she did. Was it last year, Britt? 2 years ago. So, I mean, that really took a lot. But, so we spent some time talking about the Affordable Care Act today and celebrating all of the benefits that so many millions of people are enjoying in this country. But we never thought that that would be the last thing that we had to do or all that our community would need. So we also spent some time looking at in these last couple of days at what challenges remain. And so we could continue to work. We continue to ask for your partnership for the National Minority Equality Forum and the Health Braintrust as we continue to ensure that our communities enjoy a good quality of life and a good quality of health that's accessible and affordable to everyone. So enjoy the evening. Look forward to coming back to introduce some of our special guests this evening.
I think we're going to do Senator Cardin right now.
Well, I don't have my...
You want to go? I'll start it off. You want to get your notes?
Yeah.
So a quick little story about our first awardee, who I had the pleasure actually to meet this evening. So every federal agency now has an Office of Minority Health, and what you'll learn, which is profoundly important, and what you'll also learn is that the National Institute of Health has an institute on health disparities. And a lot of that is a consequence of our first awardee. And one of the things I like about Washington is that we change the lives of people here who never even know what happened, why it happened, and they suddenly get health care. Their life gets extended, the quality of their life improves because of the work done by folks like our first awardee. So I'm going to let Congresswoman Christensen introduce our awardee.
We're going to do this together, right, Gary? Yeah. Our awardee is so great, he needs two of us to introduce him. So we're really honored and humbled to honor Senator Ben Cardin with the Lifetime Achievement Award. And every single person in this room and beyond who cares about health and health care, public health, especially health disparity elimination and health equity, knows how great this health equity warrior is. Without his fearless leadership and his absolute unwillingness to accept mediocrity, this nation, and especially this nation's most underserved and far too often forgotten individuals and communities, simply would be in a worse state. With his brilliant staff, especially one that we honored as a congressional staffer, Priscilla Ross, who's here this evening, he has provided a voice for the voiceless in one of our country's most prestigious and influential sectors. And he has done so with integrity, with diplomacy, with an unparalleled command of the issues, and in a manner that so few elected officials do today, with humor and sincerity.
As both a former member of the U.S. House of Representatives and as a senator, he was first elected in 2006 and then re-elected in 2012. Senator Cardin not only is extremely respected, but he's also very well liked. His biography is in the dinner program, and we encourage you to read it.
However, I wanted to share something about Senator Cardin that I think makes him extraordinary and so very deserving of this honor and award. I know that everyone in this room has heard the saying, success has 1,000 fathers and failure is an orphan child. Well, that's so true, especially as it relates to many health equity, minority health improvement, and health disparity elimination achievements that this nation has made. Now, as we heard earlier today, we have a long way to go. However, we have made progress, a lot of progress, and much of it is to the credit of Senator Ben Cardin. Without him, as you heard, the Office of Minority Health at HHS would not have been strengthened and elevated. The other offices of minority health across new offices across other HHS agencies would not exist, and the National Institute for Minority Health and Health Disparities at NIH would not exist.
Without Senator Cardin, minority health and health equity warriors across the country and in the United States territories would have much less of a voice, be much less informed, and dedicated voices in the United States Senate would not be there. And without Senator Cardin, the naysayers, and there are a lot of naysayers, and cynics who claim that health disparities are a non-issue would not have such a strong and unwavering voice, silencing their false and ill-advised claims.
And without Senator Cardin, so many of the other pithier provisions of the Affordable Care Act and other recent health legislation, such as access expansion provisions, the provisions that protect, preserve, and strengthen community health centers and community-centric health equity efforts, and so very important, the guaranteed dental benefit included in the Children's Health Insurance Program would be legislative priorities and hopes instead of today's realities.
I think it's safe to say without Senator Cardin, we would just not be as healthy and as strong a nation as we are today. And without Senator Cardin, those whose medical needs exceed their financial resources would continue to suffer.
Clearly, we are so pleased to honor you, Senator Cardin, with this awesome award, the Lifetime Achievement Award. We could not think of a more deserving and extraordinary person to receive it. Congratulations, and please join us on the podium.
Wow. First, thank you for this extraordinary honor, and I mean this. This is an extraordinary honor that you have given me tonight. To be associated with this group is an honor in and of itself, and then to receive this recognition is really overwhelming. Gary, I thank you for what you have done with this forum, what you've been able to do in focusing on minority health and developing an action plan to make so much progress. And to Donna, Christensen, let me say, your legacy in this Congress is incredible. You have accomplished a focus in the Congress on minority health and health disparities. It wouldn't have been there but for your efforts. And I congratulate you. We will miss you in the Congress of the United States, but we know that you will do well in the Virgin Islands. Thank you so much. I know my colleague Barbara Lee will be recognized later, but it's nice to be with her, and thank you for everything that you've done in the Congress to advance these issues. You're always on the front line of these battles, so thank you, Barbara Lee, for your work. And let me, it's a great honor to receive this award, but when I know that John Ruffin is the co-honoree tonight, it makes it even more special. What you have done at the National Institutes of Health to elevate minority health and health disparity as a true institute, a true partner. I congratulate you for a lifelong career in advancing health care to all people. So well done. Job well done. Donna mentioned Priscilla Ross, and I'm going to embarrass her a little bit here. But I tell you, I am so fortunate to have Priscilla Ross on my staff. The progress that we've made on pediatric dental was a strategy developed by Priscilla Ross. The progress that we made, she absolutely, we get the credit, but the progress that we made on these offices of minority health in the Institute, this was a strategy that Priscilla Ross developed, working with other offices, working with other advocate groups, focusing all the time. And I could give you another dozen examples of health progress that have been made because of this extraordinary staff person. So Priscilla, thank you. As I've told you before, all the honors that I receive as a result of your hard work. Let me just make a couple of brief comments. I took the oath of office as a United States Senator in January of 2007. And we all know the numbers. You hear the statistics. You hear the millions that are being denied care. But it hit home to me when one of my constituents, a 12-year-old, DeMonte Driver, who lives only about 10 miles from here, in the wealthiest state, in the wealthiest nation in the world, lost his life because he couldn't get access to dental care. It was a shock, and it drove home just what it means in this nation that for so long denied equal access to health care, denied equal treatment to health care, denied equal resources for research for health care to our minority community. You all know the cost of that denial. You understand it's, yes, billions of dollars that it costs, but you recognize that the value of America is better than that. We can do better than that. So we're on a journey. We're on a journey to make a difference, to really provide equal access to care in America. We're on that journey because we know that this nation can do much better. John Ruffin financed a study in my hometown of Baltimore that looked at where you live and how it affects your life. That study showed that depending on the zip code that you live in Baltimore City, you may lose a generation, 30 years difference in life expectancy. We can't let that continue in America. We can't. You know the numbers. An African American child is 60% more likely to have asthma. You know the numbers on heart disease. You know the numbers on mental health services. They're all equally disproportionate. We're on a journey, and we've made progress, and tonight, yes, we can celebrate. We can celebrate the enactment of the Affordable Care Act. Thank you, President Obama. Thank you for your courage. Thank you for your leadership. Millions and millions of Americans now have quality health insurance that didn't have it before. Thank you, President Obama. No longer pre-existing conditions. Thank you, President Obama. We have a National Institute of Health, Minority Health and Health Disparity. Thank you, President Obama, for your leadership. We have billions of dollars that have gone into qualified health centers so we can have prenatal care and mental health services and dental services in our community. That's what the affordable health care represents. But as I said, we're on a journey. We're not there. We have so much more that we need to do. And I'm proud to be your partner on this journey. Thank you for this honor. Let us celebrate tonight and rededicate ourselves to make this nation the great nation it needs to be.
We're cooking something up now.
I think I have this. It's wonderful to have Barbara Lee here with us, Congresswoman Lee. Thank you for being here. We also have a former congressman with us that I'd like to recognize. That's Jim Slattery, former congressman from Kansas. Where are you? I want to recognize him. Thank you for joining us. What are we doing now?
I'm going to ask Congresswoman Lee to come up. So, and I'm going to ask the former members of the CBC Health Braintrust Fellows to come up and join me.
That's what they were doing up here. How are you doing? Okay. I was wondering. This is just some of them.
Yeah, the Congresswoman doesn't know about this. I love these size of things. The individuals standing here reflect a very small subset of the interns, fellows, and scholars who started their career in policy in the office of Congresswoman Christensen. With the exception of one fellow who joined the FBI, every other fellow, scholar, and intern not only has continued their education and careers in healthcare and social policy, public health, or politics. They are therefore a major part of her legacy. But perhaps you should hear directly from them. So there's some of the interns and scholars to come up.
Good evening, everyone. So my name is Daniel Dawes, and I am the proud graduate of the Christensen class of 2006. And it's really a great honor to be here tonight and share with you why Congresswoman Christensen means so much to me, why I hold her in great esteem. I know every health equity advocate in this room would agree that she is a national treasure and a light from which many have been lit, and I am so proud to count myself among those. Thank you so much, Congresswoman. You know, one of my favorite books, Outliers, The Story of Success by Malcolm Gladwell, underscores the attributes that make one truly successful. Beyond intelligence and ambition, and we know the good Congresswoman has all of those qualities, the author found that there is a common theme among successful people. They persevere, they have integrity, and most of all, they value people, all keys to true success. During my time as a Lewis Stokes Health Policy Fellow, I was impressed by Congresswoman Christensen's tireless advocacy, her leadership, and unwavering dedication to advancing policies and laws that positively impact vulnerable and often marginalized populations. She is undoubtedly a remarkable leader, public servant, and advocate, but most importantly, she has been an exceptional mentor and friend, not only to me, but many others who were before and after me. As staff, fellows, interns, and volunteers in her office, Congresswoman Christensen has mentored, elevated, and guided us, provided encouragement during our most difficult moments, and has consistently proven to be the type of person who takes ownership in our success. During my fellowship and throughout the years working with the Congresswoman, I have learned from her that effective advocacy entails not only being policy savvy, but having political acumen. Understanding not only the problem, but the need to develop meaningful and comprehensive policies to tackle the health disparities confronting our communities, policies developed utilizing a health equity lens. She taught me the importance of time and the sense of urgency that is necessary to effectively develop and implement health policies. Now, it's because of her outstanding service to our nation and what she has done to elevate the issue of health equity why we now have the most comprehensive statute that directly addresses the elimination of health disparities. And I'm talking about the landmark health reform law. I remember the stages of near death for this law and how each time she acted with tremendous grace under fire. She taught me that successful advocacy is like riding a bicycle. You have to balance competing interests while continuing to move forward. I believe what's most remarkable about Congresswoman Christensen, beyond being a hero and a mentor to many, is her humility, her genuine regard for people. Absolutely. And her steadfast commitment to working with diverse communities to improve the health of all communities and bring our nation one step closer to achieving health equity. And Congresswoman, as you move forward in the next chapter of your life, I know you will continue to strive assiduously, without exception, for a more equitable health system, one that is intentionally inclusive of underserved and disadvantaged populations. And so I just want to thank you so much again for your leadership and for being a role model to many, many of us. I really appreciate that. And you know that you will be missed, but your legacy continues to live through us. So thank you again for everything. You know we love you. God bless you.
Gosh, it's always hard to follow Daniel Dawes. Probably should have gone first so you guys would be a tad bit more impressed with me. But I just want to echo everything that he said. It was absolutely my honor to work with Congresswoman Christensen and Britt. I was a part of the Lewis Stokes Fellowship class of 2009, 2010. I just want to thank you for all of your contributions to reducing health disparities and promoting the health of racial and ethnic minorities. I thought I understood what the definition of health disparities meant, but I really, truly didn't understand the plight of other racial and ethnic minorities and the uninsured and the underinsured until I worked in your office. So it was absolutely my honor and my pleasure. You will truly be missed on Capitol Hill, but you have mentored scores of young advocates to continue your legacy on. So I wish you the absolute best. It was absolutely my pleasure to work for you and for Dr. Weinstock, and I will let my other fellows from my cohort speak as well. Thank you so very much for all of your contributions for all the years. We love you so much, and we wish you the best. Thank you.
Hi, my name is Waverly Gordon. I was with Congresswoman Christensen as a Lewis Stokes Fellow from 2010 through the class of 2010 through 2012. It was an amazing experience. I'd recently finished school. This was my first job out of law school, and to join the staff of such a respected and smart, brilliant, all the, descriptors you can think of was amazing. And to have that person look just like me was even more amazing. To say, I can look up and see what I can aspire to be. And it's not that she just looked like me. She addressed issues that affected us. She wasn't the quiet face at the table. She made a point of saying, this is a problem, you're going to hear it whether you want to or not. And I think that's my greatest lesson that I definitely learned from you, is to be a voice. Like, we're here for a reason. I definitely respect what you've done as far as mentoring us. And definitely throughout my career, I plan to follow you, and I hope to have people who are my mentees the way that you do. And definitely best of luck in your future. I agree with Daniel, you're definitely a national treasure, and it just was amazing, and thank you again. I definitely feel blessed to have had the opportunity to work for you.
Good evening, everyone, and I'm Mariah Johnson, and I was a 2010 intern in Congresswoman Christensen's office. I was a Barbara Jordan Health Policy Scholar. And similarly to what my fellow colleagues have stated, my first foray into politics, into policy, was as an intern in Congresswoman Christensen's office. And I am currently a senior LA in Congresswoman Barbara Lee's office, handling her healthcare portfolio. So suffice it to say that Dr. Christensen truly, ignited a passion in me for policy and for health equity and for ensuring access to, for underserved populations to health care. And as Congresswoman Lee often says, it's a fundamental right that that Dr. Christensen has truly been fighting for, and I know will continue to. As a young African-American woman from Oklahoma, there weren't many African-American women around me that I can look up to who have the achievements and has done as much as Dr. Christensen has. And so I'm just internally grateful for the opportunity that she provided to me to be able to work on, a slew of issues in her office, advancing the policy issues that she has championed for so long. And so I just want to thank you for being an inspiration and for really giving me and all of us a chance to really work on these issues in a meaningful way. Thank you, and you will certainly be missed, and we all love you.
Good evening. My name is Virgil Miller. I am a former fellow, Lewis Stokes Urban Health Policy Fellow from the 2006-2007 class. I actually had the pleasure of doing the fellowship along with Daniel Dawes, who you heard from just a few moments ago. As I mentioned, my name is Virgil Miller. I currently serve as Chief of Staff for Congressman Cedric Richmond from New Orleans, Louisiana. And I say that not to talk about me or what I do, but I say that, and Congresswoman Christensen knows this, I say that I would not be where I am now if it were not for her. And I can say that unequivocally, for the support that she's provided, for the recommendations that she has provided over the years. So I certainly owe my professional career to Dr. Christensen. Let me speak briefly, and I'm under strict instruction by Britt Weinstock to be brief. So I just want to mention one characteristic that I have learned from Dr. Christensen and I have taken with me and I try and incorporate into my everyday living, and that is her disarming kindness. As a member of Congress who deals with issues that aren't always the sexiest issues on the Hill, but are certainly what I would argue are the most important issues. She has never been the member in the room to be the most boisterous one. She's never been the one to issue idle threats, but she has, time and time again, been the most effective member in the room. And it is largely due to her disarming kindness. When I was with the House Energy and Commerce Committee as a fellow and then as a professional staffer, I was instructed time and time again, whether it was the tobacco bill or if it was health reform or FDA bills, whatever it was, go and make sure that Congresswoman Christensen is happy. Those were my instructions. Those are my instructions. And so time and time again, I had the pleasure of working with her and with Britt, and it was a great experience. It was a good experience for me because of the investment, because of the opportunity that she provided, because of the faith that she had in me as a former fellow, as a young African-American professional staffer on the Hill in the area of health policy. So I am here to thank you, to salute you for the great body of work that you have amassed, and to also thank you for who I am and where I stand today and for your tremendous contribution to my life. Thank you so much.
I am just so proud of all of them. All of them.
So it would sound like the Congresswoman is headed towards retirement. We're about to give her a job well done. But she's just redeploying. She ain't left the battlefield yet. The war is still on. And we want to recognize her in a very special way. We can give her some flowers, and I think that'd be sort of nice, but that's not in keeping with what she's done and what she's taught all of us. So I have the tremendous honor this evening to announce the formation of the Donna M. Christensen Institute for Health Equity. I'm going to ask Congresswoman Barbara Lee.
Thank you very much. Good evening. First, let me just say how bittersweet this is in many respects, Donna, but how I cannot think of a more fitting tribute to you than the establishment of the Donna M. Christensen Institute. She has created an amazing legacy. And I just have to say a couple of things, because this is for all of us, very difficult, but we know that we'll be able to visit you as the next governor of the Virgin Islands. We understand that, so that's kind of, if we do our work. But I've known Donna for so many years, and I was a staffer to Congressman Dellums, who actually introduced the first National Health Service Act many, many years ago, when our great warrior Congressman Lou Stokes established the Health Braintrust. I was at that very first meeting when Lou established it. And I just have to tell you, Donna, I know that Congressman Stokes is so proud and so pleased and so honored that you have led this effort into the 21st century. When we started out, we never expected or thought that Congresswoman Donna Christensen would take it to the next level. I mean, she's taken it to many, many next levels. And so I just have to thank you, first of all, Donna, on behalf of the Congressional Black Caucus and on behalf of all members of Congress, but also on behalf of those who now finally, and Senator Cardin, I think you laid it out so well, finally have a chance to have universal, accessible health care that they can afford, where they will live longer and live healthier lives. And that is a testament, Senator Cardin, to yourself and to Congresswoman Christensen. Now, yes, Donna is very, first of all, very tough and very smart, but she is a kind person. But that tough love, let me tell you, goes a long way, because I was with Donna on many, many occasions as we negotiated the Affordable Care Act, where she was at the White House, face-to-face with our president, face-to-face with those who were really honcho in this in the White House, making sure that health disparities and that communities of color and that the social determinants of health care were part of the Affordable Care Act, and she would not back down. She would not back down. I saw this. Almost every week we had to deal with this. The president was so committed to this and needed Donna and all of us as a quad caucus then to really push forward, and Donna did. And I just have to say that had it not been for Congresswoman Donna Christensen, the provisions of the Affordable Care Act as it relates to health equity, they would never be there, because the political will was there by our president, but on the Hill, we had to do a lot of work. And Donna educated members of Congress. And how can you say no to the only female physician in the House who knew what the deal was? There was no way they could say no. No way. Also, I just have to say, Congresswoman Christensen never forgets her district. It's always, Barbara, be sure I'm on the Appropriations Committee, and let me tell you, she says, be sure the territories are in. Don't forget the territories. Make sure they're included in HIV and AIDS, and PEPFAR, and Ryan White, every single issue as it relates to health care. If, in fact, some forget that we have to include the territories, Donna makes sure that that forgetfulness is never more, and that they remember the territories in every policy initiative that we champion. I've been with Donna in the Virgin Islands, and I can tell you one thing. Her constituents know her. They love her. She's in touch with them. That's why I know that she's going to be our next governor of the VI, because she has that connection. She has that connection with her constituents and has never lost that touch. She goes home every weekend. Sometimes I go to California every weekend. Here Don goes to the Virgin Islands every weekend, to do the work with her constituents. And so I just have to say to Congresswoman Dr. Christensen, thank you so much. We're going to miss you. I don't know, and I'm so proud of all of our fellows and interns, and you heard Mariah, no notes. She's got up here, all of them, no notes. They got up here and just said everything they needed to say in, 3 minutes. They know how to do the 3 minute and be very focused on the important parts because of Donna and her training. So we're going to miss you, Donna, but I think this institute really is a true testament to your legacy and to your work. We're going to be sure that it's funded, right? We're going to be sure it's funded. And we're going to be sure that health equity and that the social determinants of health care stay above the radar in every health care policy that we bring forward, debate, and as we implement the Affordable Care Act. So thank you again so much for this honor tonight for my sister, our friend, our great leader, Congresswoman Dr. Donna Christensen.
This is such an honor. I'm really humbled by it. And I just wanted to let you know that all the while we were fighting for the Affordable Care Act and our health equity provisions, my distinguished chair of the CBC was Congresswoman Barbara Lee. Yeah, so there was no way we were going to lose. Thank you, Barbara. Thank you for your leadership, and thank you for your friendship.
Thank you. We'll have dinner now.